proudly presented by Seva at Home India in collaboration with Futurist, and we extend our gratitude to Futurist for making this opportunity possible. So I'll just give you the brief information about Seva at Home. Seva at Home is a trusted provider of comprehensive corporate wellness solutions designed to enhance employees' health and productivity. Our services include managing on-site medical rooms, health checkups, conducting different webinar sessions, offering teleconsultations. And additionally, we also provide reliable home care services for the employees and their family members, including post-hospitalization care, chronic condition management, and elder care support. So I'm very pleased to welcome Dr. Nimish Narkar to today's webinar, where he will guide us through the effective strategies for monitoring diabetes. So the first 25 to 30 minutes we will dedicate to his presentation, followed by an open Q&A session where you will have the opportunity to ask the questions. So Dr. Nimish, the floor is yours. Thank you.
Yeah, thank you, Mr. Ashutosh.
I'll just upload my presentation. Please give me a moment.
Yes.
So, first of all, I thank Seva at Home and Futurist Group for giving me this opportunity to talk on this very crucial issue, which is in nowadays world, that is diabetes. So, before we go ahead, I'll just want to know how many of you are more than 40 years of age. So, among the audience, maybe I guess 50% would be above 40 years. Another question is how many of you are currently diagnosed with diabetes? And third question for you all is how many of your family members are living with diabetes? So, having this background, it is very important for us to know, as per ICMR, in India, approximately 101 million have diabetes, and 15.3% of the population are in pre-diabetic range. Pre-diabetic range is somewhere just before diabetes, which may be termed as impending diabetes. So it is very important for us to know about diabetes, to understand, to prevent and manage the diabetes. So this presentation or this awareness talk for today is specifically as today, 14th November, is observed as World Diabetes Day, and November is Diabetes Awareness Month. So I'm privileged to give this awareness talk today. So to start with, let us understand what is diabetes. So diabetes is basically a long-term condition, chronic condition, wherein body has difficulty in regulating the blood sugar levels. So it can be diagnosed when the fasting levels of sugar are more than 126 or the postprandial level. Postprandial is 2 hours after food levels are more than 200 milligrams per deciliter. So basically 126 and 200 uh, are the levels beyond which the person is diagnosed as diabetic. So there are various types of diabetes. Type 1 diabetes usually develops in the youth. Type 2 diabetes, which is often lifestyle related, but it is more common in adults. But these days, due to very faulty dietary habit, it is rising in youth. And there is something called as gestational diabetes, which develops during pregnancy. So also let us understand how this insulin works, because uh, we have just heard that uh, diabetic individual has to take insulin. But how this insulin works is, so considering this as a body cell, insulin has its own position on that cell, after which, I mean, after the insulin sits on that particular receptor, the glucose channel opens, and thus the glucose which is there excess there present in the blood, it enters the cell. So in other words, we can say that insulin is like a postman who delivers sugar to the required body tissues. It delivers sugar from the blood vessel to the body tissues wherever it is required, like the muscles, the fat tissue, and other important organs. So without insulin, the entry of sugar into the cell is not possible. So as you can see, this map indicates how the trend of diabetes is increasing. We can see South African countries, Middle East countries, and Southeast Asian country like India, Nepal, Bangladesh, Bhutan. These countries are having very high amount of rising trends in diabetes. So that is why it is very important for the for being aware about diabetes, as it has very serious health impacts. Like it can increase the risk of heart disease, increase the risk of kidney failure, increase the risk of vision loss. So you can see how the healthy kidney looks like and how a diabetic kidney may look like. So therefore, it is very important to manage blood sugar level through lifestyle changes and medications. These can prevent the future complications of organs. So coming to types of diabetes again, type 1 diabetes is basically an autoimmune disease. What do you understand by autoimmune is where the body attacks insulin producing cells. So if the insulin producing cells are themselves attacked by some specific cells in our body, then the insulin won't be produced. And if the insulin is not getting produced by the body itself, we have to administer through external source. So here the treatment requires insulin. Whereas in type 2 diabetes, the body becomes resistant to insulin, which is often linked to lifestyle changes. Hence, it can be managed by diet, by exercise, and sometimes by medication as well. The gestational diabetes type is what occurs in pregnancy. So here, if at all the woman is pregnant and she happens to have increased blood sugar level, this requires insulin treatment, but after her delivery, she is free from diabetes for certain period of time. But there are very high chances of having type 2 diabetes later in life. If she was diabetic during pregnancy, later on after her delivery, she might be normal, but there is very high risk of type 2 diabetes development in her future life. So, what can be the symptoms of the patients? What can patient complain? So, most commonly, the patients complain of frequent urination. They also complain of increasing thirst. They complain of fatigue, tiredness. They complain of blurred vision. They complain of unexplained weight loss, which is specifically for type 1 diabetes. Sometimes exceptional weight gain can also occur in type 2 diabetes individuals, and they may also complain of slow healing sores for frequent infections, like if there is some kind of injury to foot or to hand somewhere, and if the patient is uncontrolled diabetic, so his blood sugar levels are not at all in control. So what can happen is, if there is any kind of injury, there is since the internal tissue is exposed to the outer environment, and in outer environment there are a lot of microorganisms present in the air. So these microorganisms will go and attack that particular exposed part of the tissue, like you can see in the foot area of this person. So these organisms, if they attack that particular area, uh, very common example if I have to give is like when some kind of sugar has fallen on the ground. So what happens to that thing? Many ants come along there and they have their own meal, good meal. So in similar fashion, these microorganisms, they thrive on the raised blood sugar levels of the patient. So this can lead to delay in wound healing, and this delay will also it may also give rise to serious complications, like the wound may never get healed, the and like if this continues, then the foot may have, or that affected part may have to get amputated or removed from the body. So these are very serious complications of diabetes. One thing to note is some people with type 2 diabetes may have mild or no symptoms initially. So usually what happens is when there is diabetic history in the family, some either of the parent are diabetic or close relatives are diabetic, and just the person comes up with a routine checkup in the OPD and without any symptoms, just that his blood sugar levels are little bit raised. So this can also happen that like without any symptoms, many patients are under the thought that we do not have any kind of these symptoms. So how can we get diabetes? Also, I don't eat any sugar. I don't eat any. I have sugarless tea. I have sugarless coffee. All these things they tell, and still their sugar levels are at raise. But the thing is, just cutting off the sugar in tea or coffee is not very much enough. Uh, so that is the thing. Like patients, they come to the OPD with increased blood sugar levels, but they have no symptoms at all. So what can be the risk factor of this? So type 1 diabetes individuals, they usually have family history. So there is some genetic uh, uh, correlation to it. Type 2 diabetes have risk factors like old age, obesity, family history of diabetes, sedentary lifestyle, and certain races. So sedentary lifestyle is very crucial thing, which at some point every one of us might be having this kind of lifestyle because we all have almost desk jobs. We do not go out in the office. We just sit at home, work from home, and just for certain period of time, we just have some food and again sit back at our place and do that thing, do our office work. So because of all these things, certain changes takes place in our body, which can definitely lead to certain metabolic adverse effects like diabetes. Also, few of you must have observed something like this on the skin fold areas like neck, underarms. So this is not something dirt on the skin. This is called as acanthosis nigricans. So this acanthosis nigricans is one of the sign of having increase in insulin resistance. Insulin resistance is something where insulin is not able to do its job. You remember the picture where I showed the insulin used to sit on that cell. So insulin is not able to. That means the cell is resistant to insulin. That cell is not allowing insulin to sit on it, and that is why sugar is not entering. The glucose is not entering the cell, and glucose is still present in the blood plasma, and thereby it is increasing the levels in the blood. Um, so this is not something to worry about. It is not something that it's okay. Like I may be obese, so that is why this is the skin fold darkening is there. But no, it is sign of one of the sign of increased insulin resistance. We term it as metabolic syndrome. So this alarms the need to go to your doctor to seek help for diabetes or any other metabolic issue. So, what can be the complications of diabetes? So, heart disease, stroke, that is brain damage, kidney damage, vision problems, which may lead to blindness, and nerve damage, which may lead to limb amputations. So, we all must be aware about heart attack due to increased cholesterol levels. So, in similar fashion, how cholesterol gets deposited in the blood vessels and cause deprivation in the blood flow to the heart, which may lead to heart attack. In similar fashion, increased excess blood sugar level gets deposited in the blood vessels, which are supplying these vital organs like heart, brain, kidneys, nerves, eyes. So, and these blood vessels are very, very narrow, very thin and very narrow. So you can imagine if the blood vessel is getting obliterated due to excess blood sugar, the blood flow to these organs will get hampered. And if this is occurring, then ultimately the damage to these organs can take place. These are termed as microvascular complications because these blood vessels are so narrow, so thin that these damage can cause very severe uh, issues to the person. So this is another just representation of the complications of diabetes, like stroke, heart conditions. Here you can see a patient with normal vision and how a diabetic retinopathy uh, patient may see this particular picture. So these are called as flashes and floaters. So what happens is there is some kind of retinal detachment. The retina is where due to which we can see the things. So if there is retinal detachment, that detached retina can float in the fluid which is present in the eye. And this can lead to such kind of vision, which is not very clear, which is obliterated. And this ultimately, if there is continuous retinal detachment, can lead to blindness as well. Another picture here, you can see symptoms of diabetic peripheral neuropathy. So what happens is when this excess sugar level, if it is affecting your nerves, so these nerves, they carry our sensations from all over the body. So the nerves supplying extremities like our hands, feet, so in those areas, what will happen is due to obliterated blood supply to these nerves, and since these nerves are carrying sensations from our peripheral areas of hand and feet, what may happen is a person may not be able to feel any kind of sensation. So, there may be decreased sensitivity to hot and cold. So he may not be able to identify whether it is hot or whether the surface is cold. He may not be able to identify whether it is soft in touch or whether it is sharp in touch, whatever the object is. There can be increased amount of numbness, increased amount of loss of sensation, burning and tingling feet. So all these things may happen, and this ultimately can lead to injuries to hands and feet. Like suppose the patient is not able to sense whether he has worn his footwear or not, and if he is wearing any kind of slippers, and if these slippers slips off his feet and he continues walking because he is unaware of wearing or not wearing his slippers, uh, he may get injury to his feet. This injury to his foot can lead to uh, infection, and further gangrene-like condition may also take place. So that is why it is very important to keep the blood sugar level in very much in the controlled level so as to prevent all these complications of diabetes. So how do we prevent diabetes, type 2 diabetes? Is if at all we are in pre-diabetic range or if at all we are in normal range, but there is family history of diabetes, then this is very important for us to know that how to prevent ourselves from getting diagnosed as type 2 diabetes. So eating whole grains, lean proteins, vegetables, healthy fats. So this is very much essential for to prevent type 2 diabetes. Avoiding bakery products, avoiding refined flour products, avoiding any kind of fast food. This is very essential. Another thing, what we should do is we should aim for at least 150 minutes of moderate exercise per week. So we usually say at least 20 to 30 minutes of exercise daily for at least 5 days in a week. That is what it should be done. So that exercise can be, if not anything, at least brisk walking. if you can go to gym, if you can do some kind of strength training, if you can do some kind of weightlifting, that is well and good. But if you cannot do have any kind of strength training, that is weightlifting or something, then at least brisk walking is what is recommended. So hence you will also maintain your weight. Your weight will be in balanced state. Um, um, Regular screening is also required for high risk individuals who are having family history of diabetes. Um, those who are having family history, those who have been diagnosed as pre-diabetic and they do not want to start any kind of medications. So definitely you will have to monitor yourself, your sugar levels, and all these things should be done so as to prevent from getting diagnosed as type 2 diabetes. If at all we are diagnosed with diabetes, what can we do? Uh, we should follow the prescribed treatment. And that is very much essential. If your doctor asks you to take specific number of specific drugs, specific tablets for your for controlling the diabetes, it is very much essential. It is not that you may skip that particular medicine, you can skip particular dose of insulin. It shouldn't be done. You should follow the treatment, whatever has been prescribed by your doctor, which is very much necessary. Otherwise, what may happen that skipped medication and unskipped meal can lead to excess sugar because the medication is not there to control the raised sugar, which can happen after your wholesome meal. And this can lead to some complication. Like if you are suffering from comorbid conditions, say like hypertension, like any kind of infection if you are currently going through, then it can pave way for those conditions to overpower your current thing and can worsen the status. So that is why it is very essential to follow the treatment which is prescribed by your doctor. Blood sugar monitoring should be done regularly to check blood sugar levels remain in the target range. It is not necessary that the sugar levels are should be up to this point only. Some variations are fine, little bit variations here and there are okay, but it shouldn't be that much stringent as well. It should be in optimal levels. So at least thrice a week or twice a week, regular monitoring should be done of fasting level. That is, after your dinner, you go to sleep. In the morning, early morning, after around say 8 hours of gap after your last meal, you can do your fasting blood sugar level. You can keep a record of it on the same day. Probably you can have your good breakfast, and 2 hours after the breakfast you can again check your sugar level, which is termed as ppbs, that is postprandial blood sugar level. So that way you may understand your own pattern of what kind of food increases your sugar level even after taking medications, and what kind of food keeps your sugar level in check. So that is very much necessary. Also, along with the medications, lifestyle modifications, as I told, a diet, healthy diet, exercise, and reducing stressful condition is very much essential. So there should be some kind of meal plan. There should be some kind of daily exercise and very stress-free life. Not very, which is quite difficult. But as much as possible, we should live some, have some kind of breaks, because stress is a condition where, body reacts to it. So it can be any kind of stress, can be physical stress, emotional stress. Your body reacts by increasing secretion of certain hormone called as cortisol. And this cortisol is known to increase blood pressure. It is known to increase blood sugar level as well. So that is why stress-free environment should be there so as that cortisol hormone is not secreted in excess, and your blood sugar and blood pressure will be within normal limits. So there are a few technologies also in diabetes care, like blood glucose meters, which we all know of. Then there is something called as continuous glucose monitors, which is kind of a device which is attached to our body, and there is external device which shows the sugar levels. It is kind of real-time glucose tracking. Then there is something called as insulin pumps. So there are lot of uh, devices, lot of ways through which insulin can be delivered can be administered to the patient. Uh, the traditional way is that bottle with syringe or pump like that. Another thing which is common, very common these days is pen-like structure, and this recent thing is insulin infusion pump. So this is something is programmed, it is set, and it senses the blood sugar level, and as per the need, it releases the insulin. So you may contact your doctor, you may consult your doctor, and as per the convenience, you may be prescribed on such kind of devices. Another thing which can help us to track our healthy food habits, our blood sugar level, our medication schedule is through various apps. There are a lot of health apps available. So we may use some good authentic app to track our daily diet, to track our carbohydrate intake, to track our fat intake, protein intake. All these things can be tracked as per the uh, application. So, so it is very important for our family and our friends to support for the people with diabetes, because this is very long-term condition, and if not controlled, it may lead to certain complications. So, you can see this old couple. I think that female, that lady is trying to check her sugar levels, and her husband probably is helping to helping her in some way. So it is like where our family also plays very important role in such condition, because many patients say that if we advise some diet changes to them, to a diabetic individual or to a pre-diabetic person, if we advise some dietary changes, what they say is मेरे लिए अलग से खाना तो नहीं बनेगा, घर में जो खाना होता है, खाना बनता है, वही खाना पड़ता है. So here the family comes into picture, where we address their kin, address their family relatives, and make them understand that the dietary changes for the patient as well as for themselves is very much necessary. Because whatever with your current diet, this is the result. This is the current situation where the patient has landed up in pre-diabetes or diabetic range. So it is very much essential for the patient as well as the relatives to make them understand how much it is important to have to take care of the person and of themselves by doing some lifestyle modifications. So there are a few myths about diabetes, like only overweight people get diabetes. So the fact is no. Type 1 diabetes is not related to weight. Type 1 is something which occurs in very young individuals. Say 8 to 10-year-old kid may also get diabetes. So it is not related to weight. It is something where the body is getting attacked by its own cells, and the victim cells are the cells which are producing insulin. So it is not related to weight per se. Type 2 diabetes, the risk factors can include genetics, lifestyle, age, and yes, weight may also take place. Another myth is people with diabetes can't eat sugar. So people with diabetes, they can eat sugar, but in moderate quantity. It is not like कि आज मेरे यार की शादी है and let us have some good amount of sweets and everything. No, the amount of sugar should be in very moderate quantity. Like suppose if you are out somewhere and if you try to have if you're hungry and there is nothing available and you had a packet of biscuit, say. So on the same day, what how you can compensate is uh, like after coming home, once you are having your lunch or dinner, that time you may decrease the quantity of your roti or your rice and increase the amount of dal or something. Or for on that particular day, you may also increase the amount of exertion, so this can be compensated, but it is not like the a complete cutoff of sugar. Very, very moderate amount of sugar can be taken. Another myth is diabetes is reversible in all cases. So let us understand that it is not like cough and cold. Cough and cold can get cured completely in say 3 to 4 days, a week of medication. But type 1 diabetes, it requires lifelong treatment with insulin because insulin producing cells are getting attacked by the body itself. So that is why external insulin is very much required for lifelong. In type 2 diabetes, where insulin uh, is there in the body, so in those cases, lifestyle changes can be done, like diet, exercise, and at times medications can also help in controlling the increased sugar levels. So it is very much important to understand diabetes, its types, symptoms, and risk factor, and management strategies. And it is also very important to get early detection and lifestyle adjustment. So doing this blood test for routine checkup, including blood sugar checkup, including cholesterol checkup, it is essential to get it done every 6 months or at least a year. If 6 months is not possible in due to some reasons, at least a yearly blood test should be done so as to know that we are on good track and we are not having any kind of complications undergoing in our body, as the symptoms may or may not be there, right? So it is very important to keep ourselves in a check. So the information taken was taken from these sources. Uh, so I thank Seva at Home and Futurist Group for this opportunity. Uh, I guess we may proceed for any doubts from the audience.
Yep. Thank you. Thank you, Dr. Nimish.
Yeah,
Let's just wait for a few minutes for questions to pop in the chat window.
sure.
So till then, Dr. Nimish, I also have few questions.
Yes,
So,
please.
like as you know, there are patients who are managing multiple medications. So,
Right.
what are the do you have to ensure like safe and effective medication management when they are having diabetes and some other issues also?
So there are very high chances where patient may forget taking because patient, as you said, he is having diabetes and some other condition like blood pressure or heart condition or something, and where he has to take 4 5 tablets in the morning, 2 3 tablets in the afternoon, 3 4 tablets in the evening. So what can be done is we can have kind of boxes for no daily thing where um, morning care medicines are kept in that box and they can have it afternoon care. These are the afternoon medicines, these are the night medicines, so we can have that thing. Or other ways to have some kind of reminder on the mobiles, some kind of apps may be of help. So as I said here, in such cases, usually old age people, they have this issue where they may forget taking these multiple medications. They may skip this medication. So here, the family members' involvement is it plays a big role, I think. So, as far as possible, the relatives should be explained. And if at all the individual is staying alone, then we may ask him to, separate out his morning, afternoon, and evening medications. His doctor or his pharmacist from where he is buying the medicines, they may help to segregate the medications and make sure that patient is taking and not missing or skipping any required particular dose in any time of the day.
Okay. And like as we know right now, technology is improving when we are
Yeah.
speaking, whether in general lifestyle or when we are telling about the health lifestyle. So, as per your opinion, like you have defined in your presentation that there are several technological based instrument are available right now in the market. So, like when we are speaking about the general public, what is your take? Like, what should be the best technology when either it is the monitor, the blood glucose monitor, that is much more better, or the continuous monitoring device that is being right now being present in the market right now. So, what are the best available sources that a general public can use?
So we may segregate it as those who are at risk of developing diabetes. Maybe they can check their blood sugar levels once in a week, or say once in 2 weeks, probably. Fasting and post lunch levels. So for them, continuous monitoring is not very much required, in my opinion, because they are not diagnosed with diabetes. Uh, I think for continuous monitoring, the individual should be diagnosed with diabetes, and if at all he is having a very high amount of sugar and is not taking his medication, or the other case can be where he is on very stringent diet and is taking everything properly as per you prescribed, but his diet is also very much reduced. So if he is getting any kind of hypoglycemia, that is, the sugar levels are decreasing in our body. So that is also not very good. It is also a serious condition. So in such cases who are diagnosed with diabetes, they can use this continuous glucose monitoring devices. But otherwise, to general public who may have uh, uh, may have the chance of developing diabetes in near future, they can use regular monitoring device, random blood sugar monitoring device. They can use it.
Okay, Doctor, we have two questions from the YouTube. The
Yeah.
first question being, can taking steroids increase the risk of having sugar? That's the number one question.
Yes, as I said, steroids is uh, uh, kind of like, as I said, as I mentioned in my presentation about cortisol level, which increases during the stress condition. So cortisol is something which is naturally developed in our body, and steroids, the complete name is corticosteroids. So it is something which is taken from external source. So it is one and the same thing. So steroids will definitely increase your sugar level. It will also increase your blood pressure. It also has many other complications. So it is not very wise to take any kind of steroids on your own. You should be taking it only under advice of medical practitioner and under advice of your doctor, and you should be monitoring, and you should be following up with the doctor regularly if at all you're on steroids, because it definitely increases the risk of diabetes. It increases the blood sugar levels.
Thank you for answering, Doctor. The next question is, what role does vitamin D play in regulating sugar?
uh, Vitamin D, it is not I mean, it is not very much related, I can say, right? vitamin D has its own role and blood sugar has its own role, but uh, optimum levels of vitamin D, because vitamin D is it regulates your bone health, it regulates your calcium levels. This calcium can if there is decrease in vitamin D levels, it can lead to decreased calcium levels in the blood, and this decreased calcium levels will affect kidneys in future, and also the raised sugar level can affect kidneys. So this can have some complications on the organs, but per se there is no there is no such correlation.
All right, thank you, doctor. There is another question. Normally, when there is a PCOD issue, few gynacs prescribe metformin, which is a
Yeah.
diabetic medicine, management medicine. Like taking this medicine, will a person without diabetes have any problem later on, or does it have, like, people who do take PCOD medication along with this, as a way to manage PCOD? What do we do about it, and what is any risk factor associated with that and for the long term use?
So metformin is known, it has been studied well and very known drug. Like we know almost everything about metformin, and it has been found very helpful in conditions like PCOD. So there is no relation, like if you have diabetes, then only you can take metformin for PCOD situation. Uh, Metformin is has shown very good result with for PCOD. But one thing which can occur due to metformin is with very long-term use of metformin, it may affect the kidney, because this metformin medication, once taken by oral route, we administer it through oral route. So once it goes into blood, it does its action, and it has to leave from our body at some point of time. So it leaves from our body through the kidneys. Because it leaves through the kidneys, it has to go from one part of the plasma fluid, that is, it goes from the blood vessels to the urine part of the vessel in the kidney. So due to this transfer of metformin for a very chronic, very long period, it may affect the kidney cells, and that is why we should keep checking on the kidney function test if the person is on metformin for long period of time. So and for PCOD, we do not take metformin beyond certain period of time. So this damage to kidneys can occur with very, very long-term use of metformin. But for PCOD, it can be used very judiciously, and it does not have any kind of adverse effects on the body as such. But for PCOD, it is very much essential to have very healthy diet, uh, uh, fast food free diet, and as much healthy eating you can do. That is very much beneficial for PCOD. So yeah.
All right, doctor. Thank you. The next question is, if you would be able to please elaborate more on precautions for pre-diabetic people. You know.
Okay. So those who are on pre-diabetic. So pre-diabetic is something when the fasting sugar levels are somewhere between 110 and 126. So there we term them as pre-diabetic, or their HbA1c levels are somewhere around 6 or something. So in these cases, what we should do is uh, the initial thing, first and foremost thing is dietary changes should be done. So they should completely avoid the bakery products, because they are mostly made up of refined flour, which is not beneficial at all. They should cut down on the fast food, because one of our teacher used to say that fast food may S is always silent. So it is not causing any benefit to you. So daily fast food or very frequent fast food diet should be totally avoided. They should have a very high amount of uh, uh, what do you say, proteins. So protein can be taken by pulses or something, or if they can have non-vegetarian diet, then eggs, chicken. So basically, what we ask them to do is, if they are willing to take non-vegetarian food, then this chicken and eggs, they should be usually boiled and eaten. They shouldn't be fried or something. Like one may say that I'll have 2, 3 omelets per day, but what may happen is once you break the egg, the proteins in it gets denatured. So it may not be of very much help to us. So that is why whole boiled eggs can be taken, boiled chicken curry can be taken. They can have high protein diet, like vegetarian proteins, whatever they can have. They should also lower down their carbohydrate levels by reducing the rice and roti ka quantity. Say if they're having 2 rotis in the lunch, they may have 1 or 2 bowls of only rice. They need not have both roti and rice in the same meal. They can no, they can increase the amount of dal, they can increase the amount of their sabzi, green leafy vegetables. So they can increase also they can increase the amount of salads in their diet. So they can fill their stomach with dal, vegetables, salads instead of making it full with rice and roti. So that can be done. And apart from this dietary changes, they also need to exercise, as I said, at least 30 to 40 minutes of moderate exercise, like fast walking, that is brisk walking, can be done daily, at least 5 days in a week. If at all it is possible for them, they can also do some strength training exercises like weightlifting or something. So this can definitely help them in uh, returning back to normal level from the pre-diabetic range. So they may not have to start on medication.
All right, thank you, doctor. And one more question. You already have mentioned about cortisol levels and strength training and regular exercises, right? So predominantly, diabetic people tend to have, cortisol level increase and they have fat around their belly. But that's the usual scene. So does strength training work better, or does regular walking, fast-paced walking, or 10,000 steps that we normally think that it's a healthy one? Does that help better? And is there any difference between the men and women, anatomy also, that how it works for strength and the regular walking exercise?
Yeah. Uh, so the walking exercises or the cardio, what we say, that is much beneficial for the heart. So there it is not like there your heart is working more because your muscles and your fat is not getting worked up, not getting used up anywhere. Your heart is just pumping faster while you are doing the brisk walking or the running exercises. But what happens in strength training is when you try to lift some heavy weight. You lift some not heavy, at least whatever 5 kg dumbbell also. So that time what will happen is your muscle is getting teared up, and this torn muscle fiber, it requires instant source of energy to work furthermore, right? So this instant source of energy, it gets from the adjacent fat tissues, because that time when your body is devoid of any kind of food in from external source during your exercise period. So what will happen is when your body is undergoing any kind of strength training, the muscle is getting torn, and this torn muscle will need some kind of food, and this food will get the muscle will get delivery of that food from the fat. So this fat will get broken down and it will get I mean matter of the fat will go and serve energy to the muscle, which is necessary for that moment of time. So strengthening is a very important, and there is a bit variation in male and female anatomy of fat distribution. So uh, as the females have pear-shaped body where the fat is very much accumulated around the waist, belly, and so this can also get improved with dietary changes and the exercise. So exercise, definitely the preferred exercise is strengthening, but if strengthening is not possible, then the last option will be the running exercises or the walking exercises. But the first choice is always strengthening.
Thank you so much for your answer, doctor. It was very enlightening, and the session was also very, helpful for a lot of people to understand diabetes and risk factors associated with it. Lovely talking to you today, and thank you, the team of Seva, to bring Dr. Nimish on call today, and we extend a warmest thanks to all the attendees today for joining the session on behalf of Futurisk Insurance Broking. Thank you so much, everyone.
Thank you so much.
Thank you so much.
I hope this session has been very useful. And after the session, at least by the year end, we all do some routine blood sugar test and see our doctor.
Of course, of course. Thank you so much, doctor. I think that's the takeaway for today.
Yeah.
Lovely having you here today.
Thank you so much.
Good evening, everyone. Thank you.